Now, you said one of the recommendations of the study is going to have to do with teen pregnancy, a work group of some sort. First of all, what is the teen pregnancy situation in Montgomery County?
Well, we've had an increase specifically for Latina young women, and that's attributed to a number of factors. Certainly, access to family planning, I believe, is one of the challenges in that. But clearly, part of what you have to address when you have that kind of spike and increase is making sure that young women who do have pregnancies carried to full term, that they still have the opportunity to finish high school, to go on to college. That is a tremendous challenge. What we know, in fact, last year from a report that was issued by the Women's Commission, is that indeed young women under the age of 19 who give birth are more likely not to finish college. They're more likely to live in poverty, and the tragedy here is that often their children also are more likely to grow up in poverty and enter an adult situation. And that's
the cycle.
Exactly. Exactly. So again, a lot of work to be done. I'm hopeful that the work group that is charged from the council, and again, there'll be a resolution forwarded, and I believe we will be successful with that. I'd like to see more substantive collaboration between both the school system and county government in this regard. I think there are a number of things we can do right in school settings. The wellness center model that we're exploring and starting to initiate across the county, that would perhaps could be an opportunity where we do more education with young women around their bodies, but really also around their behavior as well.
What is the wellness centers?
They're school-based health centers
okay.
That are being located, again, in strategic high school settings where there are more needs around health services, and obviously more poverty, where the demographic would suggest that these are the kids that are not likely to get the appointments with the counselors or even the appointments with regular primary doctors.
Will they be providing all kinds of services, including reproductive health?
Well, not at this time. I mean, there's a very clear policy with MCPS that the reproductive family planning, that kind of service is not available on school site. There is a quiet referral network that is taken advantage of. But again, I think we need to do a lot in reaching out to young women who decide to make this choice. And certainly there have been many studies that show that the increase in teenage pregnancy, it's not unique to Montgomery County. It is a trend, a national trend. In fact, there was a Guttmacher Institute study about 2 months back that showed the trending. And they actually aligned that increase with the fact that we were providing, as a country, more focus on abstinence education rather than really talking and supporting services around family planning. So there's something to be said for perhaps changing our focus a little bit as well.
The abstinence movement seemed to have defeated the whole purpose of of not having young girls become pregnant. Now,
yeah, I think to some degree that's true. As someone who's worked with adolescents, have a clinical background in that regard, I've often told parents that when kids age and get out on their own, when they're in that high school range, you have to really be able to talk to them directly about safe behavior.
Right.
You can't anticipate that kids are not going to try different things, and that includes having an active sexual relationship, and that includes kids using substances as well.
Right. What's the timeline do you see for the teen pregnancy work group and all of that, and just moving us a little bit closer to reality and getting young women the help that they need and the services that they need, really?
Well, I would think that the work group would be charged by the summer, by the end of council session, end of summer, and it would seem to me they'd probably get back to us with some type of report perhaps by the beginning of the next calendar year, perhaps just in time for next year's budget. But again, given what we know about this year's money and next year's money, I'm not sure that's going to translate into a lot of dollars that are going to be spent on it. But it's important to have a blueprint for the future.
Yeah, it must be hard if you have a passion for something to see things done, and knowing that we have this big problem with like no money to get it all done, and seeing how big the problem is that needs to be fixed.
It is frustrating. There's no question about that. But again, you know, I'm an optimist, and I believe that the federal government understands the need to infuse local jurisdictions with money, and there are always ways to leverage government funds with private funds. And I believe here in Montgomery County, there's going to be opportunity to do just that.
Well, that's all we have time for right now, and thank you for coming here and talking to us today.
Well, thank you very much for having me.
You're welcome. And thank you for watching. I'll see you next time.